What challenges might family and friends of someone who's living with ankylosing spondylitis experience?
One of the difficulty is that they don't know what the patient is going through, and often they may not necessarily understand it. So unless patients explain to them what they're going through, they can't read a person's mind or a person's body, especially since it's such a non-visible condition. They also have to, the family and friends, they need to learn about it. So it's very important for them to get educated about the disease so that they can better understand and know what to expect and to know what the person is going through.
When patients are asked about their disease, they're often asked what caused their ankylosing spondylitis. Is there a cure for it? What are some of the ways that can help them answer these tough questions?
So the cause is a difficult one. So ankylosing spondylitis is what we call an autoimmune disease. So the cause of it is the immune system, which is meant to react against infections and outside things, starts to react against the self. And that's what causes inflammation in the spine, the joints, and the other parts of the body. Now, there is a genetic component to it, which means that there are certain genes that increase the risk of developing ankylosing spondylitis. But it's not a genetic disease, and that blood test is HLA-B27. But it's not a genetic disease in the sense that it's not directly inherited or directly passed down to the children. And even if people have this HLA-B27 blood test, it doesn't mean that they will get the disease. And lots of people in the general population have this blood test and never get ankylosing spondylitis. And with regards to a cure, unfortunately, we don't have a cure for this disease. So we have medications that are very effective at controlling it and very effective at preventing it from progressing. But those medications only work for as long as people remain on the medications.
Patients often ask us if employees are required to disclose their disease to their employer or to their coworkers.
So there's no legal obligation to disclose. So the labor laws in Canada don't require you to disclose. Unless at the time of an interview, if you believe that your disease will prevent you from performing the essential duties of a job, and that you think you would require adaptations to do that job, then you would have to disclose it at the time. But people have to recognize that disclosing doesn't mean telling everybody. So you can be selective in the way that you disclose. So you may choose who you tell, what you tell. You don't have to say everything about it either. So you might tell HR, but not your coworkers, or your employer doesn't have to know if you're talking to HR. So, there's it's not an all or nothing thing either.
Patients living with ankylosing spondylitis have a big support team: family, friends, healthcare providers, employers. What are some tips to help them communicate their disease to those support people?
Communication, as we know with everything else in life, is always a challenge. And often I hear from patients that they feel misunderstood. They feel that people around them don't really, there's a lot of myths or misconceptions. So it could either be that there's these false beliefs that people have, or it can just be not feeling understood. So communicating about your disease is really important.
Physical intimacy can be difficult for people living with ankylosing spondylitis. What sort of things can you help them with in terms of talking about it with their partners or with their healthcare providers?
Yeah, that's a really difficult one, and often the physicians won't necessarily be asking, partly because they don't want to be perceived as intruding in your private life or prying. So, sometimes, and some physicians will be comfortable asking and some won't. So I think it's important for patients to recognize that if this is an issue for them, it's important for them to talk about it with their physician. And it's important they can talk about it in the same way or in the context of talking about the other ways that their disease affects their daily life. So the same way that they will talk about how they're affected in their daily activities, the things that they can't do, or how they're affected at work, and then in the same context they can talk about how it's affecting their intimacy. But it's really important to communicate about these things. So it's really important to explain to your spouse or your partner that when you're having pain, so that then together you can figure out how to find alternatives that are not painful. But talking about it is the first step.